Okay, so what we're gonna do now is we're gonna access the port. We're gonna draw labs. We're gonna give medicine, and then we're gonna de-access the port. So the first thing you would do is look at your orders. We do have orders from Mr. Barley to access his Metaport. So you would come into the room, knock on the door, identify yourself, identify your patient, check for any allergies. And you'd also want to look at his port, make sure everything looks okay. I usually ask my patient, do they have any trouble accessing it or anything like that. Next thing you're going to do is to bring into your room, you're going to need your dressing change tray. You're going to need an extra mask. You're going to need several syringes of saline, heparin. You're going to need a needle, a needleless cap, your lab tubes, your medicine, and then that's all you're going to need to get started. Then right before you get started, wash your hands, and then you're ready to start. And remember, it is sterile. So you've already told Mr. Barley, you've already told him that you're going to wear a mask and he's going to wear a mask. So there's his little mask. Open your kit, get your mask. Got your mask on, you want to make sure, say, Mr. Barley, can you turn your head the other way and keep it there for me? Then you are going to remove your sterile gloves. Then you're going to want to add your needleless cap to your sterile field. Add your Hoover needle. And then you're going to add your syringe and your needle. Now also when you do this, you're going to have to remember that you're going to have help. So when we're checking you off, you're going to have help, because once you touch this, it's not sterile. We'll be in the room, just ask us to open it, clean it, and we will help you. You don't ask us though, we can't do it. You really can't do it by yourself. So then you're going to want to put on your sterile gloves. Mine are kind of wadded up, so we'll just have to do the best that I can. We'll throw that away. Now you're ready. Remember, you're still sterile. You're going to connect your needleless cap. Had to think about it a minute what I was doing. Now this is ready. You're going to connect your empty syringe and your needle. Now you're ready to get your saline. Remember, you're still sterile. If you will help me, if you will open that bottle of saline, pop the top. If you'll clean off the top for me. Remember, you're going to put in your air. Then you're going to drop 10 cc's of saline. And then you're done. And then you're done with that. And then this goes back here. You'll disconnect your needle. And now you're going to prime this Hoover needle. Put it on, unclamp, and prime your line. Make sure to re-clip it, but not your glove. Lay that back there. So now you're ready to clean the site. Pop your ChloroPrep, and then you're going to scrub and clean. Then you're going to pitch that. Now you're ready to access your port. So you tell your patient, okay, Mr. Barley, we're getting ready to access, okay? Go on the count of 3. 1, 2, 3. It will stop. It will hit the back of that port. Then you're going to want to check, make sure you're in, check for access, check for blood. Unclamp. Then look, you've got blood, so you're good. Remember, this has got saline, so you're going to push, pull, push, pull, push, pull. And as that last bit of saline's going in, you're clamping, because you want that pressure going that way as you clamp. Still stabilize your needle. Then you're going to add your tegaderm. Take it off, put it on there. Once you do that, your sterile fill's over. You still want to stay clean, but your steril's over, so you can remove all the masks. Now, the next thing you're going to want to do is you've got orders to draw a CBC. We've got our lab files in the room. This you're going to need some saline, and then you're going to need a empty 10 cc syringe. We have just flushed it, so we don't have to flush it again. We are going to pull back to get 10 cc's, and per policy it's just going to depend upon your hospital. Some it's 5, some it's 10. Pull back and get your waist full of blood, take it apart, connect your empty one to draw your labs. This is waste, goes in your red bin. You're drawing your labs up, disconnect, and then you're going to flush it with 10 cc's of saline. Just go ahead and leave that connected and lay it right there. This is our 10 cc's of blood. You're going to connect a needle to it. You have your lab files. They are vacutainer. It will pull however much it needs. You're going to do both. Then this goes in your waste receptacle. It's gone. These, we're going to pretend like labs right here, and we will hand those off. Your lab may not be there at bedside, but when you get these, make sure you put your patient label, date, time, and who drew them up, and put them back in your bag. But for right now, we're pretending the lab is in the room, so we don't have to do that. There, thank you, lab. All right, now Mr. Barley has orders for some Zofran. So we'll have our Zofran in our room, right here. First thing you want to do is open your Zofran, clean the top. Read your label, make sure how much he gets. He gets 4 milligrams, so that's 2 cc's. Put your 2 cc's of air and draw back on your medicine. This will come out, go in your red receptacle. You have your Zofran. Disconnect your saline. Connect your Zofran. Again, per your policy, however long, whether it's 2 minutes, 4 minutes, push, pull, push, pull, push, pull. And then you're going to flush right behind it with another 10 cc's of saline. Disconnect, connect, push, pull, push, pull. After that is your heparin. Again, make sure you're looking at your heparin, make sure you know what's ordered, how much you're given. Connect your heparin, push, pull, push, pull, push, pull, and remember, as you're pushing, make sure you're clamping. When you push that heparin, you are done with that. Then you would clean up all your mess, which could take a few minutes. Send your labs. Next thing we have to do, we'll just pretend he's going home now. It's been 2 or 3 days, a week, whatever. He's going home. You come in and say, hey, Mr. Barley, here you're going home. We're going to get that port out for you. When you come in, you would need a new kit, or you would need some sterile gloves, a mask for your patient, a mask for you, some saline and some heparin, and you might need some gauze and tape, because when you pull that port out, it might bleed a little bit. So we've come into our room. We have a mask on him. I have a mask on. I have my sterile gloves on. We're going to start peeling this up. Facilities are different. Some may need alcohol to peel it. Some you pull and that tension lifts it But however it does, remember this is gonna stick to that needle. So as you're pulling, be careful and stabilize that needle. Well, I'm not starting over, but before I should have removed this. I should have done my saline and heparin. So we've cleaned it with alcohol. We've added our saline. We've unclipped. Push, pull. And as we're pushing, we're clipping. Then we're going to do the same thing with our heparin. Same thing. And then we would remove this. Then it's still stabilized and say, okay, Mr. Barley, I'm pulling out straight up. Usually they lock. When I don't have a dressing, but we'll pretend like this is it, go over. Because a lot of times they will bleed just a little bit. This goes in your receptacle. Be sure to look at your needle, make sure everything looks good, nothing's missing, and then you are done. And make sure they leave the dressing on at least 24 hours and teach them and tell them what to watch for, whether it signs and symptoms of bleeding. And that's it.